Now to the GMA cover story. We have a woman who says she was misdiagnosed by doctors because of her weight for years. Rebecca Hiles says she was body shamed and told her size was leading to her health problems. But it turns out she had cancer. 28-year-old Rebecca Hiles says for as long as she can remember, doctors have responded to her medical complaints by telling her to lose weight.
It was very scary to sort of exist in a body that I thought was failing me and have medical professionals who didn't seem to take me seriously.
When Rebecca was 17, she says she came down with a bad case of bronchitis and walking pneumonia, which her doctor treated her for. But 3 years later, she was still plagued with persistent coughing fits.
By the end of it, I had coughed up blood repeatedly. I shouldn't have to sleep in my shower every night because I can't breathe.
Rebecca says she was on a laundry list of medications, but nothing helped. She says that all changed when she met a doctor who looked past her weight and worked tirelessly to figure out what was wrong with her. Rebecca credits that medical team for putting her on a path to receiving her shocking diagnosis.
It was the first time in my life that I remember having a doctor take me seriously. The first moment I saw my surgeon, who said, "You have carcinoid cancer," and the time that I had surgery was 2 weeks.
Rebecca's story appearing in this recent article for Cosmopolitan, where author Maya Dusenberry says she found many women are getting judged too quickly by their doctors.
A big part of the problem is just this tendency by healthcare providers to assume that any symptoms can be blamed on weight. Everything from like a broken ankle to a sinus infection.
Research shows that fear of being fat shamed makes patients more reluctant to go to the doctor. According to a 2016 survey conducted by the Women's Heart Alliance, 45% of women canceled or postponed appointments so they could shed some weight before having to get on the scale at the doctor's office. Now, 6 years since her surgery, Rebecca says she's speaking out so that women are encouraged to become their own health advocates.
Had a diagnosis been made 2 years prior, had it been made, when I was 20, maybe things would have been different.
And we wish her all the best. Dr. Jan Ashton is here, of course, and how does this happen?
Robin, I have so much to say on this, and it's such an important topic. I think let's distinguish patient side, physician side, and then what we can all do about it. From the patient side, it's really important to understand we make a medical assessment first visually. What does the patient look like? It is a fact that being overweight or obese does carry with it certain risks of other things. It is also a fact that you can have more than one thing going on at the same time. So you can be overweight or obese, have a cough, you can have an infection, and you can have lung cancer. And I think that it's important for patients to understand that making a diagnosis is a very involved, complex process, but they also need to hold their healthcare provider accountable. And if they are being made to feel, you're not hearing me, express your feelings. That can totally turn the tables and give the patient more power. Sometimes the provider needs a wake-up call. They need to say, wow, you know what? I didn't realize I was being insensitive, so they can shift gears and approach it in a productive and compassionate and sensitive manner.
Thank you for that. You are board certified in obesity medicine. What do we do?
Well, listen, I think that is the key. As physicians, we need to understand that we have an onus of responsibility to understand what a patient is dealing with. And there are physicians now who are trained in LGBTQ patients. There are physicians who are board certified in dealing with overweight and obese patients. And if you've been out there in the fields for a long time, you are not up to speed on that. That can affect your ability to deliver good care. So I think that that is really important. The other thing that we need to remember is that a lot of patients don't realize there are ethnic, religious, racial, social, sexual aspects of a patient that do up their risk factors of certain things. When we point that out, ideally, we're not making a social judgment, we're making a clinical observation, but we need to do that in a way that's effective and kind and compassionate. And important. And as a society, we need to drop this stigma because it is affecting the care that people get, and that can't continue.
You are fired up about this.
I sure am.
I know. Well, thank you.
It's important. It's really, really important. We hate to hear women or anyone suffering like this.
We do.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.